Am I a good candidate for the Vampire Facelift?
The Vampire Facelift has gained a lot of attention for its somewhat controversial name, the term vampire being associated with a youthful appearance by using your own blood. The term can be confusing, particularly the word facelift, which should be clarified. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I've been a certified member of the Vampire Facelift Network of physicians for many years, and I've been a resource for media periodically when a question arises about the procedure, often after someone famous brings attention to it. It's important to clear some misconceptions about this procedure. The most common misconception with the Vampire Facelift is that it can actually replace a surgical facelift. This is not the case. A surgical facelift lifts descending tissue and skin upward, combined with tightening the muscles in the deeper facial tissue. I generally perform surgical facelift for patients about 60 years and older who have significant signs of facial aging and tissue descent. The procedure called Vampire Facelift, as practiced by trained and certified members of the Vampire Facelift Network, consists of two elements. The first being a single syringe or 1 cc of a hyaluronic acid filler such as Restylane or Juvederm to elevate from the underlying bone or soft tissue and enhance areas such as the brows, tear trough, or cheeks. Dr. Runnels, who invented this name and procedure, explained that the lift is the tissue being lifted outward as opposed to a surgical lift, which is more upward. The second component of the Vampire Facelift is the use of platelet-rich plasma, or PRP, which is derived from your own blood, hence the vampire name. PRP is harvested from your blood, which is first drawn like it would be for a routine lab test. To concentrate the PRP, the blood is spun in a centrifuge, separating the heavier red blood cells from the clear yellowish plasma. Platelet-rich plasma contains a host of wound healing and growth factors, which are needed when you have a cut. These same factors can be used to improve the skin by using the same wound healing elements to build collagen and improve blood supply. PRP can also be made into a thicker form with a gel-like consistency by adding calcium, which makes it more viscous, and it's referred to as platelet-rich fibrin matrix, or PRFM. Essentially, you're improving appearance by adding volume with a hyaluronic acid filler and improving skin quality and luster with PRP. There is also a well-established benefit from combining hyaluronic acid with platelet-rich plasma. The Vampire Facelift as a procedure by itself is best for people in their 30s and early 40s. This is a time when facial volume loss becomes more significant along with changes in the skin. A surgical facelift is more suited for significant skin and tissue descent seen in your 60s and older. In between, when the face has significant volume loss but limited skin and tissue sagging, I recommend a volume-enhancing procedure called Structural Volumizing. This involves placement of longer-lasting fillers at the level between the bone and overlying muscles. The Vampire Facelift doesn't involve any significant recovery or healing time. Patients can feel and appreciate benefits immediately. The benefits of PRP will be ongoing for several months afterwards. The Vampire Facelift is considered a lunchtime procedure, and patients often return to work right afterwards. The Vampire Facelift has created greater awareness of the benefits of PRP or platelet-rich plasma for more youthful skin, which when combined with the volume-enhancing benefits of hyaluronic acid filler can help the right candidate look better. It is not an alternative for surgical facelift, nor is it enough for more significant facial volume loss, which requires more cosmetic filler than a single syringe. I hope you found this information helpful. Thank you for your question.